So primary care doctors are generally pretty well educated to manage most musculoskeletal injuries. They're going to be your first line of defense for the most part. Many of them are not comfortable with dealing with certain things, so that's where we come in handy because we may manage a lot of the non-surgical things that a primary care may not want to take care of, but our surgeons don't necessarily need to see. But in sports medicine, the thing that we want to do is make sure that we can accurately diagnose you so that we can have a good time frame for how long you need to rest or be out and how quickly we can actually push the envelope to advance your return to play status rather than just blanket saying, well, you sprained your knee, you're out 2 or 3 weeks. You can do that. A lot of people will get better if they're not having a severe injury. But if you tell a coach that their star athlete is out for a knee sprain without giving some specifics, and you've just cost them a third or a fourth of their season, and they didn't necessarily need to be out, you're going to have some explaining to do. So I think that's where seeing a sports specialist can come in handy. Accurate diagnosis, proper return to play, proper management. For concussions, we obviously deal with those day in and day out, so we're a lot more comfortable dealing with the severe symptoms that can occur and guiding people through treatment of it. And if you don't deal with it on a regular basis, it can be challenging to figure out what's the right thing to do, what's the proper steps, when do you bring in other specialists like a therapist or certain medications that can be used. Having treated that on a daily basis, that makes a big difference. And then there's weird conditions that only happen in sports where people exercise too hard and they start to break down their muscles. And it's not just soreness, it's actually a pretty serious injury that can harm somebody if you don't stop them from doing it. It can have some pretty catastrophic events if you don't know what you're doing. Heat stroke being a classic one for South Texas. A lot of people say, well, he's having heat stroke, get him in the ambulance and hospital will take care of him. Hospital can't cool an athlete on the way, and neither can the ambulance. So actually the first thing we want to do with those kids is put them in an ice bath and get their core temperature down before we even think about getting them to an ambulance or hospital, because they're going to roast from the inside if you don't take care of it quickly. So there's a lot of subtleties, and I think most doctors know that, but sports medicine is a growing field. And on the primary care side, they're realizing how much expertise we can provide at mass events on the sidelines. And Dr. Schmidt, I think, is been a pioneer in a way that he was early to recognize that he's not going to operate on a sideline. So, somebody like a primary care doctor may be more useful to him because we can manage some of those medical emergencies, also handle those fractures that we can stabilize there until they get into the emergency room if needed, and handle all the other stuff on the side that he wants no part of.